Welcome to this episode of Patient Perspectives in HIV Prevention, a CE podcast series. If you are seeking continuing education credit, please review the front matter for disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practice.cme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Allison Agwu and her patient of many years who first started PrEP during a clinical trial. Thank you for your attention. The podcast will now begin.
It is so good to see you today and to talk about something that's been a central part of why we got to know each other as patient and doc. So really glad to hear your experiences today.
Yeah, it's really glad. Thank you so much for having me. And I'm really happy to be here and to have this conversation and chat. And hopefully this would be some learning opportunity for somebody out there. So thank you so much for the opportunity.
Awesome. So you get to count as a PrEP old head, and meaning you were PrEP really way before PrEP became mainstream and cool. And I'm just wondering if you could share what was it that made you even reach out and to try PrEP in the first place?
I think for me, growing up, there was, a possibility of being exposed to HIV one way or the other. And that I saw that as an opportunity to help myself.
Did you perceive your risk of HIV being high?
Yes, I think that at the time when I started the study, my risk wasn't necessarily high at that time. Well, it was, but I felt like my risk was going to increase. And I knew that, and I just figured that this is the time to sort of get on and sort of see what this PrEP thing is about before that risk increases and, possibly contracting the disease.
What kinds of things were you already doing to prevent HIV at that time? And curious how you thought PrEP would potentially be used in a way to have you be able to have sex the way you wanted to. Just curious how you factored in PrEP in what you were already doing.
So at the time, it was definitely, abstinence was one as best as I could. I lived with my family at the time, but again, I knew I was moving out and going to college, and so I would have a lot more opportunities there and freedom, and also condoms were one thing, that I definitely used. That was definitely a good preventative measure. But I also realized that I think culturally in the sort of gay scene in that environment, it was almost normal to go bareback or like without a condom or without protection. And so after having a few slip ups where, the condom broke or, there were sort of situations like that, I realized that, again, it was in my best interest to get on PrEP as more of a as a sort of confident measure to prevent that versus like the condoms that can break, abstinence, which is more the spirit is willing but the flesh is weak type of situation. But yeah, that was that.
Okay. So was that sort of the moment, what was the thing that said, this is the thing that's going to make me take PrEP? Was it when the condom broke? Was it an STI? What was it that finally said, I'm going to make this happen in terms of PrEP?
Well, it's interesting you mentioned that. I think that it was a combination of all of those factors. I think one was the main factor that I was moving out, going to college. I knew I was going to be more exposed. There was going to be more people. I wanted to explore my sexuality a bit more. Two was that I'd had experiences where condoms broke and I didn't know, what the situation was. People could tell you they were negative, but that was not necessarily, you can't take that at face value. And then also, I'd had some STIs as well, which definitely meant to me that I was getting closer to possibly contracting this. So it was more like, I need to get on PrEP so that STIs I could possibly treat. HIV was more of a long-term sort of thing, and I wanted to sort of get on the forefront of that. So I think I would say it was a combination of all those factors.
So it's interesting that you mentioned that and you observe that in your own life. I mean, there's certainly have been studies showing literally for individuals who are diagnosed with HIV, you look back and within 6 months to a year, they'd had a prior STI, whether it's chlamydia or syphilis, et cetera. And those are sort of missed opportunities to intervene in that diagnosis. And it sounds like you clinically, you were seeing that for yourself and made the leap yourself. Did you know anyone else who was on PrEP? And did you know anyone who was HIV positive? Just curious if you knew that.
Yes, so I didn't know anyone who was on PrEP at the time. I think I was the first person who knew anything about PrEP in my circle that I knew anything about. I knew a few people who were positive. But again, I think that's one of the motivating factors, right? There was no direct way to know that this person had HIV, right? Or they were HIV positive. They looked normal like everybody else. And I think that even scared me the more because it made me realize that, people could say they're positive and I may have had sex with people who were positive and I did not know it because they did not disclose. And so PrEP was the way for me to, whether they disclosed or not, or whether they're honest or not, it was a way of sort of protecting myself at the time.
Mm-hmm. So an additional sort of security blanket in some way on top of what you were doing.
Yeah.
So one of the things that is often talked about is two things, I should say. One, you are a man of color, right? And in terms of, the data is always 1 in 2 Black men who are, MSM will acquire, HIV in their lifetime, sort of really daunting statistics. And however, when you look at PrEP, in terms of who actually accesses PrEP, there's huge disparities in terms of African-American males or Black males not accessing PrEP despite having this really high use or high risk. So just to frame that, and we oftentimes see these step down where people come in and they may get to a provider to get that PrEP prescribed, and then they are less likely to go get that PrEP. And so recognizing you came to PrEP through a study, what was the thing that said, okay, I'm going to come get this prescribed? What was your thought process as you were going to take that first pill? What were you concerned about? What were you afraid of? or what thoughts went through your head?
Going through my head before I started PrEP or before I went on PrEP, I was thinking about my privacy. I was concerned about that. I was concerned about what my family might think or my friends, if they knew. I was concerned about, well, is this real? This is a whole study. And, am I on a placebo or is this like the real thing? I was concerned about side effects, if there were any side effects, whether short-term or long-term side effects. I was concerned about, people knowing that I was on PrEP and maybe even misdiagnosing or misrepresenting me and thinking that I'm HIV positive versus, being on PrEP.
So you mentioned side effects. Did you have any side effects?
So side effects, I would say initially was maybe flatulence, maybe change in my digestion or the consistency of my digestion, so to say, would have been side effects. Maybe some nausea, very mild initially. These were pretty much at the early onset of PrEP.
What were you told about adherence and how to adhere to your PrEP? And, would love to hear how that went for you in terms of what you were advised on adherence.
So adherence, I know the goal was to, take it every day, and so that you can build it up at 100%. And for me, obviously, initially, I would say I was taking it every day. I was very religious about it. Over time, over the years, I may have reduced my adherence a bit because I just felt like I built enough tolerance and, I may not have been taking it 7 days a week. And maybe I went down to 5 days a week. And we talked about, okay, maybe a 90% coverage, with 5 days a week or thereabouts. So that was my adherence schedule for the most part.
You're not going to get in trouble. So curious, were there certain things that made you more likely to take it versus not? Or, were certain relationships you were in or certain times or seasons of risk? Curious how you may give some insight into what was going into that decision making.
Yeah, that's a very good point. I think that, well, first, initially when I started, I was adhering 100% because it was a new study. I wanted to make sure that, they were taking samples to test, that it was in my body. So I wanted to make sure that I was compliant. One. After that, when I sort of passed the first few months past the compliance phase, I think I based my adherence based on my risk, right? I knew that I was having more unprotected sex with other people, and so I wasn't necessarily sure about their statuses. So I continued that adherence to make sure that it was optimal in my body.
Mm-hmm.
After, at some point, I was in a relationship, so I paused that for a while. And then, sometime during my relationship, not to put my personal business out there, but there was, some infidelity issues and there was an STI involved. And so that rang up to me that the risk has just increased as well. So I needed to get back on it, even though I was in a relationship. And I would say, again, adherence was, again, based on my sexual behavior or practice. If I knew that I was going to be promiscuous or I was going to be having unprotected or even protected sex with some people regularly or often during a particular period or season, I would be more consistent with my PrEP versus when I had some, lulls where I wasn't as sexually active.
I think that's helpful to be honest about. I think certainly, we say there's that aim to go for 100, but what I love what you're talking about is sort of how you calculated your risk based on what, hey, I'm going to be doing this, so I'm really going to be really adherent or not, and kind of really adjusting. If you were going away for 6 months and you were going to be in a combine for whatever period of time with nobody else, then you were adjusting that. Not that you did that. So I think it's important to have these honest conversations. And when there are studies actually trying to figure out what that is, and it is certain partners where you're in a monogamous relationship, certain things where you may adjust that PrEP take.
Mm.
So curious, you were in PrEP for a period of time as part of a study, and then you were on PrEP out of a study where we continued to have a relationship, and you got PrEP for me. Can you talk about some of the challenges you may have had in terms of getting PrEP in that setting, or as anything that was potentially a barrier?
Yeah, I think that while getting PrEP on the study was just very accessible. I had there was a team involved, and you could reach out to people if you had any questions or if there was a scare or concerns or anything like that. Outside the study, it wasn't hard getting it. I think because of the relationship I had with Dr. A, and I think the other challenge was when I moved away from the city. Just again moved to a different place. It was just having to see, because I think the requirement is you have to have an appointment or meet an appointment every 90 days. So scheduling that appointment to be able to sort of renew the PrEP was, because of the distance, was sort of like an issue or sort of a challenge there. But aside from that, I think, overall, it's so far, at least looking back now, PrEP is easily more accessible. Primary care doctors, more familiar and aware about it. And, it's, again, you get a 90-day supply. I was able to get a discount from the producer or from the makers of the product. So that reduced my copay significantly. So that meant that I could afford it, and it wasn't something that was, uber expensive. So I think accessibility has just been great post the study, but particularly because I was in that study. I think if I was not in that study, it would have been definitely more difficult to get than versus being in the study.
So wondering, since you're such a seasoned veteran of PrEP, have there been periods where you've stopped PrEP for a long period of time and then restarted, or just curious how it's played out over the years since you've been on it?
Yes. I would say, like I mentioned before, I sort of take my doses of PrEP based on my risk assessment at the time. And I sometimes go through months of, non-sexual activity. And so during those times, I would pause my PrEP and I just wouldn't be taking them. Or in some cases, at least, more recently, if I knew that I was possibly going to be sexually active, tomorrow or something like that. I may get my PrEP today and take it tomorrow, and then just dose it for the next, sort of few days while I was having that sexual activity.
So what you're alluding to is the on-demand PrEP strategy, which is not currently approved in the US, but in some places it is essentially where you take 2 doses in one, which is oftentimes considered more challenging for young people to take. And it speaks to your age that with growing, but adding a little bit more years, that this is something that you have done research on your own, and also something that I can do. But again, not currently approved in the US as a strategy, just to say that. But there is data or some studies to try to show that this does actually work, right?
Yeah.
So I'm curious how COVID-19 has changed your experience with PrEP.
So I would say COVID, for me, has not helped with meeting people, because I just haven't been meeting people as much. For me, I haven't been as sexually active during COVID, so my PrEP is still my adherence is still pretty much similar to what it was prior to now.
There actually has been some data coming out that has come out showing that PrEP starts were down, people reaching out for PrEP, HIV testing was down. So definitely impacted how people, engage with their PrEP, and speaks to the need for more strategies, telemedicine, testing in different ways to get people access to PrEP when we're not able to go get it the way we normally do. You always have done your research and looked into things. And so you're probably aware there's now, thoughts about injectable PrEP and implantable PrEP and different modalities. And if you had to say, long-acting oral pills for PrEP, you only take once every certain number of months. Wonder what your thoughts are about the different strategies, and how, if there was one, would there be another one that you'd want to use, or how you think it may impact PrEP use for individuals, including yourself?
Yeah, and in my experience, talk to other people who are on PrEP now, I think that's one of the things that that is challenging for them is the adherence, right? Taking that pill every day, remembering to take it every day, and being consistent with it. And I know for a fact that they've even brought up conversations about it would be nice to just have a shot of this, or take one pill every few months, or ever so often, and I can imagine that they'll probably jump on board quicker if those options are available to them, of course, at an affordable rate, versus having to take the medication, every so often.
So just curious, let's say someone comes to you and says, hey, I'm thinking about PrEP, and what would you advise someone in terms of trying to? Yeah.
Take it.
But that's it. Okay.
No, I really think I think that it's almost like when you look at COVID-19 right now, and they're talking about the vaccines and building herd immunity. It's similar to that, right? Especially in the non-heterosexual sort of world. Sex is prevalent. Infections can be rapid, and so if you can find a way to get more people on board to take this prophylaxis, it will definitely reduce, the infection rates. It will reduce new cases. It will reduce, spread and all of that. And so I've always been a big advocate for PrEP. I think my best friends, so all the people who are really close to me, all are on PrEP now, and they all know that I've been on PrEP, and I was in the study with Johns Hopkins and all of that. And so, they know that this is me. And so I always tell them and I advocate for it, because I think that it's not just protecting us in this interim, but it's also protecting others who may be naive or not aware of PrEP, or not even aware of the sexual, the HIV status, or but are still promiscuous or still having unprotected sex. So that way, I think it will cover the bases for the most part.
So I have one last question, and this is awesome. It sounds like what I love about you is that you thought about it, you sought it out, you did all these things, and I can reflect on many of the conversations. You would always come in with your information to ask questions. But there are a lot of people who still are not accessing PrEP. And what would you suggest would be the best way to sort of get the word out there about PrEP and the benefits, et cetera, for those that are not as informed and enlightened and don't happen to be your friends?
That's a very good question. One, I would say that I think the first start is with medical providers. I think that it's very important that they're informed about PrEP and what it is, because I know that, typically if you go to a doctor's office and you have a complaint for an STI, then they ask you certain questions, and that could be an opportunity for the providers to recommend PrEP, for people who are sexually active, whether they disclose that they have sex with men or otherwise, so I think that is one step. And then two, I think is in awareness, creating a little bit more sort of outreach, not just on PrEP being PrEP, because I think people know that PrEP is a thing, and there's also this concern, so to say, that everybody's saying they're on PrEP, but who's really on PrEP, and how are they actually adhering to their PrEP? Do they have a 90% sort of immunity coverage versus a 50%? So if it's 50%, then I might as well just feel like I'm having sex with someone who's positive. But again, you don't know what people's adherence levels are. So not just informing people about taking PrEP, but how the best ways and the most effective ways to taking PrEP, and even other possible options and modalities that they can take PrEP, I think is definitely key. And then making it accessible across the board, whether it's through health clinics, whether it's through big hospitals, just again, I think my main focus or suggestion would be to focus on the medical providers, where, if we can prescribe more of those and just continue to maintain, like we had in the study, right? There was a follow-up, there's, a team, there's maybe have a team like that in every major hospital where they have their own sort of teams that follow up with people who are on PrEP, making sure they're getting their prescriptions, and sort of the companies that produce some of these prophylaxis, making them readily available and affordable for people who may be from lower income areas or who are people of color who may not have the knowledge or the awareness, and so again, I think some of those factors would definitely help.
I can't, underscore that more. I oftentimes say, expand into pharmacies, your CVS, your Walgreens, like really, meet people where they are. Not everybody can come to Hopkins, and not everybody can come to a major center. And so, the school health clinics, I mean, literally expanding where and who prescribes PrEP. I cannot say enough how it's been wonderful talking with you today. I think we've always said in our patient-doctor interactions that it's bidirectional, and hopefully you've learned as much from me as I've learned from you. It really has been a privilege to be involved in this journey with you, and great to see how well you're doing and how PrEP has affected your life, and to see you blossom into who you've become. It really has been my extreme honor to be a part of that.
Well, I would say thank you so much, and I definitely echo those sentiments as well, Dr. A. I think you have been just amazing, as both a person and a provider and a doctor and a clinician, and I wouldn't be here without you, truly. And I truly feel my life has changed from PrEP, because the one major thing that I was really scared of from a health perspective or a health scare was HIV. And the fact that I got on it, you stayed on me, you made sure that I was taking what I was, taking my medication, offering these other options of condoms and ingraining that into my head, so that I'm not just taking PrEP, I'm just having random sex with everybody, but also still being conscious about my health and the impacts that it would have. I think definitely has changed my life trajectory. And I see myself as a sort of like a mini beacon in a way to the folks around me, as an example that they can see that, okay, this is somebody who is doing well, and, he's on PrEP. And again, there's no stigma necessarily, and no one's necessarily like saying, oh, well, he's on PrEP or whatever the case may be. And now we're normalizing that behavior and erasing that stigma. So I would definitely say it's been an honor for me as well, just having this conversation with you. And I really appreciate the opportunity, and it's been really great. So thank you so much.
Thank you for listening. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.